Welcome. Today, we are diving deep into the world of invisible medicine. We're talking about how scientists use tools that are literally at the atomic level to figure out what's going on inside our own bodies and solve some really tough medical mysteries.
Okay, so let's just start with this question. What if your doctor could send microscopic spies into your body? Tiny little agents that could sneak around and report back on what your cells are up to, where they're going, and what might be going wrong. It sounds like something straight out of a sci-fi movie, right?
Well, guess what? They can. It's real, it's happening. And these little atomic spies have a name: radioisotopes. And no, it's not fiction at all. It's an incredibly powerful tool that's been revolutionizing medicine for decades now.
So what in the world is a radioisotope? Well, think of it like a special version of an element, like iron or chromium, that's just a little bit unstable. And to get stable again, it has to release a tiny burst of energy, which we call radiation. And this is the magic part. That radiation acts like a glowing breadcrumb trail, a little signal that scientists can follow with amazing precision.
And it turns out these glowing breadcrumbs aren't just for medicine. They're actually essential tools used in all sorts of fields, from industry to environmental research. But for today, we're going to focus on how they help us understand the incredible machine that is the human body.
Let's kick things off with one of their most important jobs: investigating our blood. This is the whole field of hematology, and for doctors in this field, radioisotopes are like a complete, indispensable toolkit.
So how do they actually work? Well, it's pretty cool. They can be used in four main ways. Scientists can literally tag or label specific cells to track their entire journey through the body. They can use special detectors to count these tagged cells as they pass through organs like your spleen. They're also used in lab tests on blood samples, in vitro. And of course, for creating these incredibly detailed images of what's happening inside you.
Now, what's really fascinating when you look at this is just how specific each isotope's job is. It's not one size fits all. For instance, doctors use chromium-51 to see exactly how long your red blood cells are surviving. They'll use iron-59 to study how your body is processing iron. But then, look at that last one, phosphorus-32. It's not just for seeing things, it's for doing things.
And that brings us to a really critical difference here. It's like two sides of the same atomic coin. On one side, you've got your diagnostic radioisotopes. These guys emit gamma rays, which are perfect for detection and imaging. They are the trackers, the spies. But on the other side, you have therapeutic isotopes. These often release something called beta particles, which can be used to destroy very specific targeted cells, like in treating certain blood disorders. So one is for seeing, and the other is for treating.
Okay, so we've seen how radioisotopes are amazing at tracking what's happening in our blood. But what about a completely different kind of mystery? One where our own immune system is the culprit. As we're about to see, the same core ideas of tracking and measuring are absolutely key, but the story, well, it takes a really interesting turn.
I'm talking about those really tricky, delayed allergies. Not the kind where you sniff pollen and sneeze immediately. I mean the rash that shows up 2 days after you wear a new necklace, or that weird inflammation that develops months after you get a dental implant. How on earth do you test for that?
Well, you call in a highly specialized detective, the lymphocyte transformation test, or LTT for short. Now, the key phrase to notice here is ex vivo. It's a fancy way of saying outside the body. It's a totally safe way to see if your immune cells have been sensitized to something, all by just watching how they react in a lab dish.
And it's an incredibly versatile tool. It's used for all sorts of things, from pinpointing allergies to common drugs, to figuring out if you're reacting to the metals in an implant, and even just to get a general sense of how a person's immune system is functioning.
So how does a sophisticated test like this actually work? Let's go behind the scenes, inside the lab, and break it all down.
It's really a beautiful, logical process. First, scientists take a simple blood draw and isolate the key immune cells, which are called lymphocytes. Then, they expose those cells to whatever they think is causing the allergy. Could be a tiny bit of nickel, a specific drug, whatever. They let that little mixture sit and incubate for a few days. And then comes the final step. They measure. Did the immune cells freak out and start multiplying? Did they proliferate in response to the allergen?
If the cells multiply like crazy, it's a huge clue. It means the patient's immune system has a memory of that substance. It's been sensitized. This reaction is then measured and calculated into something called a stimulation index. And a high index, well, that points right to an allergy. Okay, now here is where our two stories, the one about radioisotopes and the one about allergy testing, they come together in this fantastic story about scientific innovation. It's so cool.
So think about it. How did scientists originally measure that cell multiplication? You probably guessed it. The early versions of the LTT used radioactive markers, our old friends, the radioisotopes, to track the proliferation. And it worked, but it meant handling radioactive material. Fast forward to today, and modern methods use something amazing called flow cytometry. It uses lasers and fluorescent dyes to count each individual cell. It's safer, it gives way more detailed data, and as the source material puts it, it's biologically friendly.
Now, the LTT isn't perfect. Its sensitivity is about 60 to 70%. What that means in plain English is that if you do have an allergy, there's a small chance the test could miss it and give you what's called a false negative.
But, and this is a really big but, its specificity is over 85%. And that means if the test comes back positive, you can be very, very confident that the result is real. It's extremely unlikely to be a false positive.
This quote really just sums up the whole journey, doesn't it? The goal is always to get the most accurate results in the safest way possible. And the evolution of the LTT, from using radioactive tracers to these modern laser-based methods, is just a perfect example of that principle in action. So, think about the ground we just covered. We went from using atomic spies to track blood cells, to using that same basic idea to diagnose complex allergies, and then innovating beyond it to create even safer, more precise tools. It's just a powerful reminder that science never, ever stands still, and it really makes you wonder, what invisible mystery is it going to solve next?